Hello everyone, it's time for another edition of HRS Presents. I'm your host, Reggie Robinson. April is National Alcohol Awareness Month, an annual campaign aimed at bringing awareness to the dangers of alcohol misuse. Alcohol Awareness Month was established in 1987 by the National Council for Alcoholism and Drug Dependence with the aim of raising awareness for communities and to help understand the causes and treatment available for one of the nation's biggest health issues. Annually, 88,000 deaths are attributed to excessive alcohol use alone, making it the third leading lifestyle-related cause of death in the nation. Excessive alcohol consumption is responsible for a loss of 2.5 million years of potential life annually. Alcohol misuse contributes to more than 200 disease and injury-related conditions, meaning alcohol misuse contributes substantially to healthcare costs and lost productivity, and affects people's health in ways they may not realize. While the majority of adults consume alcohol socially in a low-risk manner, some misuse alcohol. It should be noted that for those under 21, they're advised not to use alcohol at all, as are pregnant and nursing women and those who have previously experienced problems with alcohol and other substances. Here are some of the warning signs that someone may be drinking too much. You drink more or longer than you intended. You try to cut down or stop drinking, but you're not able to. You need to drink more than you once did to get the effect you want. You continue to drink even though it makes you feel depressed or anxious or adds to another health problem. Loved ones or trusted friends have made comments about your drinking. You spend a lot of time drinking or thinking about alcohol. You find that drinking interferes with daily activities, family, friends, or work. Or maybe you've had legal problems due to drinking, or you've experienced symptoms of withdrawal when you don't drink, such as shakiness, sweating, tremors, headaches, anxiety, irritability, and/or insomnia. Remember that a standard drink is 12 ounces of beer at 5% alcohol content, or 8 ounces of malt liquor at 7% alcohol content, or 5 ounces of wine at 12% alcohol content, or 1.5 ounces or a shot of 80 proof distilled spirits or liquor. If you're concerned about your drinking, here are some suggested steps to control it. Set a daily and weekly drinking limit. Write down your limit and keep it with you. Record how much you drink each day. Avoid situations and triggers that cause you to drink. Ask a friend to help you stay within your limit. Or talk with a doctor or a mental health professional about your alcohol use. Many health organizations define low-risk drinking for adults as consuming no more than 2 standard drinks a day for men and 1 standard drink a day for women. If you regularly exceed those amounts, you may be headed for trouble. Over time, alcohol misuse can result in the development of an alcohol use disorder, or AUD. Previously, AUD has been referred to as alcohol abuse, alcohol dependence, alcohol addiction, and colloquially, alcoholism. It's important to note that the terms alcohol abuse and alcoholism may increase stigma, whereas using the diagnostic term alcohol use disorder may help reduce stigma. Alcohol use disorder, or AUD, is defined by the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, as a problematic pattern of alcohol use leading to clinically significant impairment or distress. and is diagnosed as mild, moderate, or severe based on the number of symptoms out of a possible 11 experienced in the past 12 months. According to a 2022 national survey, about 1 in 7 men, 1 in 11 women, and 1 in 33 adolescents meet the diagnostic criteria for AUD. Thus, it's important to know how to identify this often undetected condition, know the resources for treating it, and to understand that people can and do recover fully from this condition. Alcohol addiction can be framed as a 3-stage cycle that serves as a model for translating the brain changes associated with AUD to the clinical domain. The first stage, called the binge intoxication stage, is associated with the development of neural circuits in the brain, which link the pleasurable, rewarding experience of drinking with cues, to the extent that the cues gain motivational significance. These and other neural circuits help develop and strengthen habitual drinking and may lay the groundwork for compulsive use of alcohol. The second stage, called the withdrawal negative effect stage, is associated with states such as anxiety, dysphoria, and irritability. At this stage, the person feels alcohol is needed for relief from discomfort and emotional pain. The third stage, called the preoccupation anticipation stage, is associated with deficits in the brain's executive functions. As it progresses in severity, AUD can cause brain changes that make it difficult to stop drinking. But with prolonged abstinence, at least some AUD-induced brain function changes may improve. A complex interplay of genetic and environmental factors influence a person's risk for AUD. Between 50 and 60% of the vulnerability to AUD is inherited. This risk is likely due to common variants in many genes. Different genes confer risk by affecting a variety of biological processes and mental states and traits, including, for example, addiction-related neurobiology, physiological responses to alcohol and stress, comorbid psychiatric conditions, and behavioral tendencies, such as impulsivity. Among the environmental risk factors for AUD, external stress may be one of the most potent. People who experience trauma, particularly in childhood, or an accumulation of significant stressors throughout life, may be prone to developing AUD and to relapsing in response to stress during recovery. The type of stressor combines with a person's genetic makeup and drinking history to influence the stress response. Furthermore, once moderate to severe AUD is established, the brain's stress circuits activate during acute and protracted withdrawal, which fuels negative emotional states and helps to maintain the addiction cycle. Indeed, negative emotional states are the leading precipitant of relapse. Additional risk factors for AUD include other mental health conditions, heavy drinking, and the age of onset of drinking, each of which can be influenced by a combination of genetic and environmental factors. People with mental health conditions, including anxiety, depression, and PTSD, have a greater risk for AUD, and vice versa. And the odds of having AUD are markedly increased among those with heavy drinking patterns and those who started drinking in adolescence, with earlier onset of drinking linked with greater risk of AUD. But people with AUD can receive effective science-backed treatment in a variety of settings, including primary care. One size does not fit all when it comes to treatment for patients with AUD. The good news is there are more treatment and support options than many people expect. Healthcare professionals offer 2 evidence-based options: AUD-focused behavioral health care and FDA-approved AUD medications. Many patients also benefit from active participation in mutual support groups, such as Alcoholics Anonymous or AA, or a number of alternatives, either on their own or as a complement to professionally offered treatment. Some of these alternatives include Smart Recovery, Life Ring, Women for Sobriety, and Celebrate Recovery. Groups vary widely in beliefs and demographics, so people who are interested in joining a group may want to try different options to find a good fit. The behavioral health and medication options for AUD offered by healthcare professionals are about equally effective and can be combined and tailored to the needs of each patient. Behavioral health care for AUD includes cognitive behavioral, motivational enhancement, mindfulness-based, contingency management, 12-step facilitation, and couples or family therapy. Medication options for AUD include some relatively new but effective FDA-approved medications. AUD medications are non-addicting. Healthcare professionals offer AUD care in more settings than just specialty addiction programs. Addiction physicians and therapists, such as those found here at Health Recovery Services, can also provide flexible outpatient care. These and other outpatient options may reduce stigma and other barriers to treatment. Telehealth services, for example, can allow people to maintain their routines and privacy and may encourage earlier acceptance of treatment. Active participation in a mutual support group can benefit many people as well. A small proportion of patients with AUD will need a few days of detox to manage potentially dangerous withdrawal symptoms before starting a long-term care plan. Individual paths to recovery vary widely, but the majority of people with AUD who seek help reduce or resolve their drinking problems over time. Please remember that Health Recovery Services provides prevention, screening, and treatment services for AUD and other substance use disorders. Our evidence-based prevention programs are available to your school or community group by contacting us at www.hrs.org or calling 740-592-6724. Screening and treatment can be accessed at 740-592-6720. By the way, if you haven't visited our website lately, check us out for more information on the services we provide to Southeastern Ohio, including residential treatment at our Bassett House Adolescent Treatment Facility and the Rural Women's Recovery Program, or RWRP. Both programs have been recognized for decades as leaders in innovative best practices for treatment of substance use disorders. HRS also provides outpatient behavioral health clinics in Athens, Hocking, Vinton, Gallia, Jackson, and Meigs counties, offering comprehensive mental health services including all forms of medication-assisted treatment. And please remember to visit our Facebook page daily for more information about our services and a variety of other topics of interest. I would like to conclude with a message of hope. Alcohol Awareness Month is a prime opportunity to decrease stigmas associated with alcohol abuse and decrease misunderstandings. Thus, we can remove those barriers that make people fear seeking treatment and recovery. The actions we take during Alcohol Awareness Month can make seeking help easier for those who need it. National Alcohol Awareness Month is a wake-up call, reminding each of us about the challenges faced by those struggling with alcohol use disorder. It also reveals the importance of community support in seeking and sustaining recovery. When we have a greater understanding of and empathy for those who struggle with alcohol abuse, we can all contribute to a healthier society. Finally, remember, treatment works. On a personal note, I know that very well. On August 22nd, 2024, I celebrated 37 years of continuous recovery from my own severe alcohol use disorder. So I know that recovery is possible. And my friends, recovery is beautiful. Well, that's a wrap for this episode of HRS Presents. As always, we thank you so much for watching. Please subscribe to our YouTube channel and like and share our videos. See you next time.